Good morning, and thank you for tuning in from throughout Newfoundland and Labrador and across the country. My name is Kathy Dix-Payton, Media Relations Manager with the Department of Health and Community Services, and I will be the moderator for the question and answer session. Joining us at the table today is Dr. Janice Fitzgerald, Chief Medical Officer of Health. Please stand by. Our news conference will begin shortly.
Good morning, everyone. Thank you for joining us today. I'll begin with an update on COVID-19 in our province. Since the media advisory yesterday, we have no new cases, and the total number of cases in our province stays at 269. 265 people have now recovered, and in total we've tested 32,932 people. I would like to express once again how very proud I am of the incredible dedication and resolve Newfoundlanders and Labradorians have shown over the past 6 months living with COVID-19. The lifestyle changes and sacrifices you have each made to protect your families, your neighbours, and your friends have been truly remarkable and unheard of in many other jurisdictions. Perhaps some of the greatest personal sacrifices, though, have been made by our province's rotational workers. Thousands of men and women who leave our province to work for weeks at a time in order to provide a livelihood for their families. COVID-19 and the public health measures in place have been particularly challenging for these workers and their families due to the requirement to self-isolate when they return home. This has been a difficult yet important safety measure, and I thank you sincerely for doing your part to keep those around you safe upon your return to the province. We have come a long way in living with COVID-19. Thanks to our continued efforts, learnings, and experiences, and like the rest of Canada, we are in a much different place now than we were when COVID-19 first landed in our province. As I have said many times before, our public health officials continuously monitor the epidemiology and best available evidence related to COVID-19. And as things shift, so too do our public health measures. To that end, today I'm announcing that effective Wednesday, September 9th, residents of Newfoundland and Labrador who work outside of the Atlantic bubble on a rotational basis, but within Canada, will be able to call 811 upon their return to arrange for testing for COVID-19 between days 5 and 7 of their self-isolation period. If for some reason the day 5 to 7 window is missed, testing can still occur after that time. Provided the worker is asymptomatic, once they have completed 7 days of self-isolation and have received a negative test result, they will no longer be required to self-isolate. However, out of an abundance of caution, these individuals must avoid large crowds and wear a non-medical mask when interacting with others outside of their bubble, their household bubble. This will be a 4-week trial to determine whether further relaxation of the rules for rotational workers can take place or if enhanced measures need to be reinstated. This change does not apply, unfortunately, to international rotational workers at this time, as the federal government's quarantine order still requires anyone returning to Canada to self-isolate for 14 days. With the reopening of school next week, I would also like to take this opportunity to reassure you that it is safe for children of rotational workers to attend school. The workplaces of rotational workers have put many safeguards in place to reduce the risk of COVID-19. But most importantly, rotational workers are well aware of the public health measures in place and have been following them from the beginning. I have no doubt they will continue to do what is required to keep their families and those around them safe. As can be expected, anytime public health orders are relaxed, people may feel apprehension and concern about potential outbreaks. Please be assured that the changes in the public health measures are closely monitored and will be adjusted quickly if required. Navigating our way through COVID-19 has always been about trying to strike a balance between preventing spread of the virus and preserving our overall health and mental well-being. Our public health system is working hard to achieve this, and I ask for your continued trust and patience in this regard. Today's announcement is another important step in living with COVID-19, and one that requires understanding and acceptance. I've seen firsthand the lengths Newfoundlanders and Labradorians will go to protect and support one another, and I'm confident we will continue to show the same attributes of solidarity, fellowship, and goodwill that characterize our province and for which we are so well known. We can do this, and we will do it together. Thank you. And I'll now turn it over for questions.
Thank you, Dr. Fitzgerald. For the benefit of our speakers, we have 5 reporters registered for today's call. Reporters will ask questions in the order they registered. They will have 1 question and 1 follow-up. First questions today are from Peter Cowan of CBC News. Please go ahead.
When you talk about rotational workers, will this apply to anyone who has to travel outside of the province for work? There may be people who their work requires them to travel, on a regular basis, but it may not necessarily be the same 2-week on, 2-week off rotation that we sort of traditionally think of.
So at the moment, this will apply only to rotational workers. So those will be people, we have a definition of that on the website, but it will apply to people who are regularly going back and forth on turnarounds to other provinces or territories in the country.
Why not apply these same rules to anyone who's returning from the province? Allow them to go through the same process to do a shortened isolation?
So we are, the evidence about this is evolving. We are concerned particularly about this group of people because of the ongoing issues that they're having with regard to having to self-isolate on a regular basis, and often they're essentially self-isolating when they're at their camps and other places of work as well. So it's been very trying on their mental health. So we're trying very hard to strike a balance here between safety and overall mental health and well-being. As somebody returning to the province who has to self-isolate for 2 weeks, it's not the same level. I mean, I understand that self-isolation can be difficult, absolutely, but it's not the same level of stress as we're seeing with these rotational workers. So right now we're considering this only for the rotational workers.
Our next questions are from Leila Baudouin of NTV News. Please go ahead.
Hi, Dr. Fitzgerald. I'm wondering how long it will take for them to receive their test results, and how is this process you're adopting different from what's happening in PEI?
So how long will it take to get their test results? Depends on where they're from, and that's why we gave a window of the 5 to 7 days. So all testing has to be done at the public health lab here in St. John's. So it will take a while for some tests to get here and get that turnaround time. So most tests now are being done within a 48-hour period. So we certainly expect that most people will be able to get their results back within that period of time. And how is it different from PEI? Was that the second question that you had?
That's right, yeah.
So PEI are doing things a little bit differently, and they have done it based on the type of rotational worker, I believe, and they're doing 3 sets of testing, is my understanding at the moment. These are different tactics. We're all trying to figure out the way that works best. This is uncharted territory, really, and so we're trying to find out the ways that that will work best. So we'll certainly be looking at what PEI is doing and comparing notes, and as time goes on.
A follow-up: is this the same for IOC workers who are doing the train route from Lab City to Cecile?
Sorry, I'm not quite sure. Can you clarify a little bit?
So I know, yeah, of course, no problem. So I know that people who are driving the train that is between Quebec and Labrador are also having to self-isolate when they are either in Quebec or in Lab City. Does this apply to them as well?
So if they're Newfoundland and Labrador residents and they're classified as a rotational worker, it will apply to them.
Thank you.
Our next questions are from Peter Jackson of The Telegram. Please go ahead.
Hello. Is there anything about the nature of rotational work that makes less of a risk, such as precautions taken at the work site?
Certainly, it is a balancing of risks. So if we think about it in pure terms, they can be camps. It can be a lot of people together who are working together, and there is that potential for spread in those types of situations. However, we've learned a lot. As I've said, we've learned a lot since the beginning of this. Work camps have learned a lot. The businesses that operate these camps have learned a lot, and have put a lot of safeguards in place with regard to how the workers spend time together, whether they eat together, if they have to wear masks on site. Some of them have testing in place. So there are safeguards that have been put in place in most, if not all, of these workplaces to prevent the spread of COVID-19. And in addition to that, they have very robust plans for what to do if a worker presents with symptoms consistent with COVID-19 as well. And, and certainly there has been a lot of learnings that have come out of some earlier outbreaks that we've seen, and the communication and the cooperation with public health authorities are certainly, much improved over where we were before. So I think we all have a very clear understanding of how things have to work now.
Okay, and I was also wondering, you say this is a 4-week trial. Assuming it goes well, what further relaxation of restrictions would you consider?
So that's something we'll have to determine after the trial. I certainly wouldn't want to make any predictions about that at this point, 4 weeks out. There are lots of things we have to consider between now and then. So.
Okay, thank you.
Our next questions are from Brian Medore of the OCM News. Go ahead.
Hi, Doctor. Just some clarification now. So someone returning to the province gets tested fairly quickly, test negative. Are they free to go at that point, or do they have to self-isolate for 5 to 7?
So 7 days is the self-isolation period.
7 days, even if they test negative at the outset?
If they test negative on day 5, you mean?
Day 5, yeah.
Yeah. So the isolation is still day 7. The reason we put the day 5 to 7 range in there is because we do understand that, it can, if you're in other areas of the province outside of the metro area, it can take a little bit longer for the test result to come back. So.
And why not have the test, as soon as they get back, day 1, day 2, something like that? I think other provinces do that.
So some are, but the provinces that are doing that are testing more than once in general for these workers. So we have decided that the isolation is still the better option at this point, and then the test at 7 days. There is still a chance. The average incubation period is 5 to 6 days, so there is still a chance on day 1 or day 2 when you get back that you could have a false negative result. So waiting the extra period of time reduces that risk.
Our next questions are from Patrick Butler of Radio Canada. Please go ahead.
Hi, Dr. Fitzgerald. I just have a clarification. Let's say a person arrives just before September 9th. How does this work for them? If someone's partway through their quarantine when this change happens, what happens to those workers?
Yes, thanks. That's a good question. So on September 9th, anyone who is day 5, anyone who's a rotational worker whose isolation period, the 7 days could be up within a short period of time after the 9th, can contact public health or can contact 811 to arrange for testing on day 5 to 7 of their isolation period, provided that day 7 is after the 9th. Does that make sense?
And the other thing I wanted to ask is the timing of this announcement. Why make it now? Is there an epidemiological reason? Is it because of the specific complaints from people? Why make this decision at this point?
So we certainly have been aware of the challenges that rotational workers have been facing, and it has been something that we've wanted to address. So we have been working on this for a while, and we have, today is the day that we sort of have finalized the plans, I guess, and decided to make the announcement. There's no other reason other than that, really.
We now have a bit of time left, so we're going to go through each reporter again to see if you have any further questions, starting with Peter Cowan of CBC News. Please go ahead.
Thanks. We've seen quite a few of the cases that we've seen over the last couple of months have been workers within Canada who returned and developed symptoms and tested positive. So what do you say to people who are saying, hold on, some of these workers are coming back, they are developing COVID-19. Why is it safe to be able to let them end their isolation a whole lot earlier?
So we've only had 2 cases in total in the province from rotational workers. And certainly, if both of those people were symptomatic. We certainly appreciate that there is a risk. There's no zero risk situation here, but we have to strike a balance. These workers make up a significant portion of our population. We have to strike a balance between their mental health and overall health and the risk in the general population. And I think this allows us to do that. We have to accept that we have to make decisions sometimes that that balance the overall health of the person and not just what's the risk of the disease spread.
Thank you.
Next, we'll hear from Leila Baudouin of NTV News. Please go ahead. Do we have any questions from Peter Jackson of The Telegram?
Oh, sorry, I do have a question. My phone wasn't working. It's
Okay,
Leila.
sure. Go ahead.
Thank you. Hi, Dr. Fitzgerald. I've been reading along reaction from rotational workers of Newfoundland and Labrador on Facebook. They've been waiting for today's announcement, but I'm reading that a lot of people are no better off with today's announcement. Some of them who are only home between 5 to 7 days. So quite frustrated, quite upset that they are still in the same predicament today as they were yesterday. What do you say to those people quite frustrated with today's announcement?
So we recognize that there are people who work less, who are home for shorter periods of time. And we hope that with the evaluation that comes from this, that we will have some more information that will help us make a decision in that regard.
Thank you.
Next, we have Peter Jackson of The Telegram. Please go ahead.
Yes, further to Leila's question, what would that information be? What sort of information would lead you to do something even a little further?
So I think we're looking at rates. We'll look at rates of infection if there are any cases, and we'll look at the overall numbers of rotational workers coming into the province. and then we'll make an assessment as to what the risk is and make a decision at that time of what we have to do. So, it's ongoing. We'll be looking at it, and I hope we'll be able to come to a resolution fairly soon.
Our next question is from Brian Medor of VOCM News. Please go ahead.
Thanks. Just one. What bracket would someone returning from a camp where there has been infection and there are cases? We had a couple last week or the week before that they worked at the same camp, and I think there were 3 cases at that camp. Where do they fit in this plan here?
Yes, so any workers who are coming from an area of outbreak would have to self-isolate. So if an outbreak has been declared at a camp, then we receive notifications about those outbreaks, then unfortunately those workers would have to self-isolate when they return until that outbreak has been declared over. And that is one of the safeguards that we've put in place to reduce the risk as well.
Next, we have Patrick Butler of Radio Canada. Please go ahead.
Hi, and could you speak to the effectiveness of this sort of measure in other jurisdictions? Have other places in Canada adopted this exact sort of structure for rotational workers? And can you talk about other places that haven't, such as PEI, and sort of the effect that we've seen there?
So I'm not aware of anyone doing 7 days in testing at this point in Canada, but PEI has had some measure of testing, and they're looking at that. They're evaluating their data. I understand they did a lot of testing initially of long-haul truck drivers and didn't have any cases in that regard. Nova Scotia right now are looking at students, and so there are some studies ongoing in the country about testing, and I guess we're all hoping to learn from those, but I'm not aware that there's any results, so to speak, from those at this point.
We do have a little bit of time left, so I will go through each reporter one more time to see if you have any additional questions. We'll start with Peter Cowan of CBC News. Please go ahead.
Dr. Fitzgerald, you were talking about this being 4 weeks. Does that, until you look at easing restrictions more, does that essentially mean that a Canada bubble, which would end isolation for all workers, isn't in the cards for the next month?
Certainly, we're not discussing opening up wider to Canada at this time. What the time frame is on that, I can't tell you, but certainly, it's not been at the tables that I sit at. It hasn't been part of the discussion recently. I think we're waiting to see what happens with schools, and there's a lot of changes happening right now across the country. So,
thank you,
Peter. Was that the end of your questioning, or did you have anything else?
I'm good for now.
Okay. Next, we'll go on to Leila Baudouin of NTV News. Please go ahead.
Thank you. I guess, Dr. Fitzgerald, if you could tell me what the top 3 things are that you want to see or that you think we should see before discussing opening up to the Canadian bubble or to allowing that traffic to come in, what would those top 3 things be?
So I don't know if I have top 3 things. I think, we have to consider a whole lot of things, and when we're looking at this. So most importantly, of course, is epidemiology and what are the trends that are happening. And, with school opening, that's always something that elsewhere in the country, certainly we're keen to see what happens with that. And I think, we have to also take into consideration what's happening elsewhere in the world as well. So it's because what happens elsewhere in the world can influence what happens elsewhere in the country, and that can influence what happens here. So there's a lot of things that we have to consider. Certainly epidemiology is the most important thing, and not necessarily our epidemiology, but the epidemiology elsewhere.
And Leila, did you have any further questions?
Yeah, I guess what are you looking forward to when we do get, more back to normal? Is there anything that you're really wanting to do? Is it a trip somewhere, or what are you looking forward to?
Oh, I'm just looking forward to getting a full night's sleep.
Fair enough. Thank you.
Next, we'll hear from Peter Jackson of the Telegram. Please go ahead.
No more questions from me. Thanks.
Thank you, Peter. Brian Medore, VOCM News. Please go ahead.
I'm fine, thanks.
Patrick Butler, Radio Canada. Please go ahead.
Yeah, I just have one last thing. Related, it's kind of related, but kind of unrelated. The public health is supposed to have guidelines for singing and wind instruments by this week, with school reopening next week. Are those ready? And if not, are they coming?
Yeah, they're in the works, and certainly, and we've been in contact with, the choral groups and people that we engaged with about this. It's just been a really busy week for us, and so we will have something in the coming days for sure.
Thank you.
Patrick, did you have an additional question?
That's good for me. Thank you.
Okay. Thank you very much. Before we end today's call, we invite you to watch the short video that has been prepared on the COVID Alert app. Thank you very much for tuning in today.
Our smartphones. We use them to keep in touch, to play, and to work. Now, your smartphone can help you limit the spread of COVID-19. Someone can have COVID-19 and not know it. They can spread the disease before they have any symptoms. The Government of Canada has developed an app that will let you know if you may have been in contact with someone who has tested positive for COVID-19. The COVID Alert app creates a random code so that no one will know your name or your location. The app uses Bluetooth to exchange random codes with nearby phones. The code is a randomly generated string of digits and letters that changes every 5 minutes, so it cannot be used to identify you. The app does not have access to your name or address, or your phone's contacts, your location, or your health information. If someone you've encountered later tests positive for COVID-19 and uploads to the app a one-time key they received from their healthcare authority, you'll be notified that you may have been exposed. If you test positive for COVID-19, you can upload your one-time key from your healthcare authority. The app will then notify the people you've encountered without revealing your identity. You can then take steps to limit the spread of the disease. If you know you've been exposed, you should contact your local public health authority and follow their instructions. Using the app is one more thing we can all do to help limit the spread of COVID-19, in addition to washing our hands, keeping 2 meters apart, and wearing a non-medical mask or face covering when it's difficult to maintain physical distancing. You can do your part by downloading the app today and helping others use it too. The more people who use the app, the better we can contain COVID-19. Help protect yourself and your community. Download the COVID Alert app to help limit the spread of COVID-19. Go to the App Store or Google Play. Find out more at canada.ca/coronavirus. A message from the Government of Canada.